Good morning, everyone. My name is Sharon Rich. I'm the Senior Trust Advisor with AGED. AGED manages special needs trusts throughout the state of Florida to help our seniors and persons with disabilities qualify for Medicaid when they're over the income or the asset limit. So as part of our mission, we like to be a resource to the community and provide training to the professionals. So today is our monthly webinar, and we are very excited to have Gary Appleseas as our speaker today. I would like to remind everybody that today's program is certified for continuing ed for attorneys, certified senior advisors, and professional guardians. You will be receiving an email from Kate at trustaged.org within a week after the presentation so that you can provide your continuing ed certificates and get your continuing ed credits, and we will be entering for the guardians. So I would like to introduce our speaker today, Gary Appleseas. He is the Director of Operations for the Senior Resource Alliance. They are the lead agency under the Area Agency on Aging for Region 7, which is Brevard, Osceola, Seminole Counties, and Orange County. I would ask everybody to put your questions into chat, please, and we're going to leave about 10 minutes at the end for the questions. Gary has been in the nonprofit world for over 10 years and has worked also in the for-profit world for many years. He has several degrees in marketing, finance, integrated health, and a variety of other things. And Gary is a wealth of knowledge. And please help us welcome Gary to the program today.
Thank you, Sharon. Welcome, everybody, to today's program. Getting to know your Senior Resource Alliance, our area agency on aging here in Central Florida. Next slide, please. So just a quick overview of Senior Resource Alliance. Senior Resource Alliance is your local, oops, lost my screen. Hold on a minute. There we are. Is your local resource for assessing the many services and programs of the state and federal government available to senior citizens, disabled adults, and their caregivers and family members. Senior Resource Alliance also is an objective clearinghouse for information and services offered by local, state, and national organizations. We've been serving our community since 1985, and of course, celebrating our 35th year here in Central Florida. For people that live in Brevard, Orange, Osceola, and Seminole Counties, who are disabled adults or at least 60 years of age or older, we are here to assist. Next slide, please. So a little bit about the ADRC. There are 11 area agencies on aging, and we are known as the ADRC, the Aging and Disability Resource Center. We serve elders and persons with disabilities in the state of Florida, serving a specific region of the state. So we're in Region 7, as you can see from the map on your right, and there are 11 regions in the entire state. Senior Resource Alliance is the area agency for Central Florida, as I said, serving Orange, Osceola, Seminole, and Brevard counties. Each of the ADRCs in the state provide information and referral to programs and services, as well as enrollment assistance for local, state, and federal Medicaid and non-Medicaid programs. Next slide, please. So the Elder Helpline, this is really our entree into the system. This is where all of our calls come in. We have about between 200 and 250, 255 calls coming into our call center every day. And the Senior Resource Alliance Helpline is the starting point for finding resources for older adults, individuals with disabilities, and their caregivers. These resources can be government funded, nonprofit services, and/or private pay options. Our goal is to help our callers find the help they need to live safely and independently. Our supportive information and information and referral specialists provide unbiased information and referrals. And there are 2 phone numbers that we can be reached at. Our local number, which is 407-514-1800 for assistance. There's also a toll-free number that people can call, which is 1-800-96-ELDER-5337. If people call that 800 number, they're actually routed to the PSA that is closest to their area. Next slide, please. So our client satisfaction rates for our Elder Helpline, all of our satisfaction surveys are in the high 90s. So 98.2% of people have voted yes when they were asked if our staff was friendly. 98.3% of people report yes when asked if our staff was attentive. 96% of people report the screening process as being comfortable and easy. 96.5% would call again for services. 93.4% would recommend us to a friend, and 96.5% is the overall satisfaction for people calling into our Elder Helpline. This survey is done through an electronic survey at the end of calls. So we ask people if they'd like to stay on to take a brief survey, and they are asked a few questions for the survey, and then we get those survey results on a regular basis. Next slide, please. So what do our clients look like? Our client demographic, 68.3% of our clients are female, 31.7% of our clients are male, and 55.9% of our clients are disabled. You can see by the little pie chart there on the right that the majority of our clients are between 70 and 79 years old, 30%, and then from there 80 to 89 at 20%, 26%. And then the 60 to 69-year-old range is 23%, and then it just goes down from there. Next slide. So calls by county. Orange County is the largest county that we get our calls in from. Of course, as we said before, seniors are served in Orange, Osceola, Seminole, and Brevard. 41.9% of our calls come out of Orange County. Osceola County 13.9%, Seminole 12%, Brevard 16.9%. You'll see we have another column called Other, which is 15.4% of our calls. And those are calls that we refer back to the correct PSA. So if someone calls in and they're not in our region, we will refer them to the correct region. Sometimes there are calls that come in from clients who used to live in our service area and who no longer live in our service area, so we need to refer them to their new service area for help. Next slide. All right, so service requests. So the biggest service request that we have is for SMMC-LTC, which is the state-mandated Medicaid long-term care program. And that is the biggest request that we have for assessments and for processing. So that's the biggest one. We have 10.4% of our callers call in for healthcare needs. So it may be a referral to an ALF, it may be referral to a doctor's office, it may be referral for PT or OT services, it could be a referral for a nursing home, etc. So it just depends on what services they need in terms of healthcare. So 10.1% of our calls come in for income support or assistance. So we do have people who call in who need assistance with their income. They need extra support in terms of having some extra money in their pocket, and maybe for housing. You'll see we'll go down this list a little later on. 4.5% of our calls are for utility assistance. So we do help people with resources such as our EHEAP program so that they can keep their power on if they're running out of funds and they don't have power. 8.1% of our callers call in for food or meal assistance. So for those, we would refer out to Meals on Wheels or congregate meal sites or other meal programs that are available and that have funding. And 7.4% of our calls that come in are for housing. Again, Sometimes we get people who are calling in that they need help paying their rent or their mortgage, so we have resources to help them with those programs as well. SHINE, serving the health insurance needs of our elders. SHINE, if you don't know what that is our non-biased Medicare program. We have about 25 counselors right now. We'll have about 47 counselors by the end of this year. These counselors are trained in Medicare every year and all the new nuances that come out from Medicare, what Medicare is, how it works. And these counselors go out and speak with people who are Medicare eligible and help them navigate through the craziness of what Medicare is and what plans are out there, and kind of help them navigate to what plan might be best suited for them and their particular needs. And that could change year by year during open enrollment and such. Like I said, these counselors and our organization are non-biased counseling, and we do not sell the insurance, nor do we recommend any specific insurance agent. We're really here as a help to guide seniors through the Medicare process and for a program that might be best suited for them. And then 3.2% of the people that call us are in need of transportation. It might be transportation to a grocery store. It might be transportation to a doctor's appointment. It might be transportation for any number of services that a senior may need that they might not have transportation to. We have a number of transportation providers that we can refer them to. Some are door-to-door, where it's just a single person going in the car. Others are van pool services, so it just depends on what the client's need actually is. Next question, next slide, please. All right, so a little bit about some of our programs. So home and community-based programs. So Senior Resource Alliance screens and places individuals into the waiting list for the following Medicaid and non-Medicaid programs. So the first one is the statewide Medicaid Managed Care Long-Term Care Program, also known as SMMC LTC, which provides home and community-based services and assistance in the home or help with costs associated with assisted living. The next one is Community Care for the Elderly, the CCE program, which provides community-based services to help elders live in the least restrictive yet most cost-effective environment for their needs. And then our HCE program, which is Home Care for the Elderly, which provides a basic subsidy to support caregivers for Floridians 60 or older in family-type living situations. And then the ADI program, which is the Alzheimer's Disease Initiative, which provides support services for individuals and families affected by Alzheimer's disease or other related memory disorders. Next slide, please. So CCE, the Community Care for the Elderly, there are approximately 44,000 Florida seniors who receive assistance under this program annually, with services ranging from non-medical transportation assistance to personal care to adult day health care. Each approved service is intended specifically to allow the elderly to age safely and securely in their homes. Special provisions of Florida laws prioritize this program for individuals who have been or are suspected of being the victim of financial, psychological, or physical elder abuse. So this program provides assistance to seniors who are at risk for nursing home placement and who are not qualified to receive services under Medicare. This program is to enable qualified seniors who require medical care, personal care, to remain living at home or in a community institution receiving care in more expensive Medicaid-funded nursing homes and residences. To be eligible for the CCE program, individuals must be a resident of Florida and must be at least 60 years of age or older. An individual must have a functional impairment with which they need assistance, so including activities of daily living, such as bathing, grooming, mobility, and toileting. This need for assistance is determined by an initial assessment during the application process as well as a reassessment on an annual basis. So that reassessment occurs every 13 months, unless there is a significant change to their needs. No income limitations on this program. If the individual is eligible for Medicaid, they are not eligible for CCE. Next slide, please. So Home Care for the Elderly, the HCE program, supports care for Floridians aged 60 and older in family-type living arrangements within private homes, such as an alternative to institutional or nursing home care. A basic subsidy is provided for support and maintenance of the elder, including some medical costs. A special subsidy may also be provided for services and/or supplies. So the basic subsidy is $160 per month, which is provided for all program participants. Special subsidies are authorized for some consumers and can be used for incontinence supplies, medications, medical supplies, wheelchairs, assistive devices, ramps, home accessibility modifications, nutritional supplements, home health aides, home nursing, and other services to maintain the individual at home. Formal case management can be provided and is provided when needed. To qualify for the program, individuals must be 60 years of age or older and have an income less than the institutional care program standard, meet the institutional care program asset limitations, and be at risk for nursing home placement, receive supplemental Social Security income, receive benefits as a qualified Medicare beneficiary, or as a special low-income Medicare beneficiary. They must also have an approved adult caregiver living with them who is willing and able to provide care and help arrange for the care. Next slide, please. So every month we have individuals that are released into the program, and that is where our Medicaid specialists come in to play. So in 2022, our team processed a total of 2,666 individuals released to determine their Medicaid eligibility for managed long-term care benefits. These individuals get released every month. This month, we had 250 individuals who were released into the system. And you can see it varies by month. Some months are higher than others, but that's kind of like a chart of what our EMS release by month looks like. So that is this year. I don't remember what the number is so far this year, but last month, the beginning of this month, we had 250 individuals released. Next slide, please. So our client satisfaction, again, these satisfaction scores come from clients who are asked to hold on the line if they'd like to take a brief survey after their call with us. So 99.1% voted yes when they were asked if our staff was friendly. Again, 99.1% reported yes when they were asked if our staff was attentive. 97.6% reported the screening process as being comfortable. 97.2% would call again for services. 94.9% would recommend us to a friend, and 97.58% is our overall satisfaction score. So remember, this is different than our helpline. Our helpline is really more for information and referral. This is for the resources that we've been discussing, home and community-based care issues. So there are two different surveys from two different sections of our staff. Next slide, please. Okay, so SHINE Medicare Counseling. We kind of touched on this a little bit, but I'll go over it again. SHINE stands for Serving the Health Insurance Needs of Elders. It's a statewide program that offers senior adults with disabilities and their caregivers free, unbiased counseling on Medicare, prescription drugs, and other health insurance matters. SHINE services are free, unbiased, and confidential. The SHINE SMP program, Senior Medicare Patrol, empowers and assists Medicare beneficiaries and their families and caregivers in preventing, detecting, and reporting healthcare fraud, errors, and abuse through outreach, counseling, and education. So we're always doing seminars and education programs for the public to help seniors better understand when things look like fraud, when they are being defrauded, and how to report those situations. Next slide, please. So we also have health and wellness programs. So we have 3 different health and wellness programs that we're currently offering. So Senior Resource Alliance provides health and wellness workshops for seniors in our 4-county region. These classes are free to the public and are intended to help seniors learn how to live healthy lifestyles and ultimately maintain their independence as they age. Listed here are some of the classes that we offer. And like I said, we have these 3 classes running right now, but we do have some other classes. I'll give you a kind of brief rundown of those if you want. But the first one is Matter of Balance class. This is a falls prevention program, probably our most popular program. It's offered in both English and Spanish. It's an interactive program that's designed to reduce the fear of falling and building core strength to increase activity levels among older adults. Chronic disease self-management. It's a program that focuses on disease management skills, including decision-making, behavior modifications, mental health, problem solving, and action planning. And then finally, our diabetes self-management program is for individuals with type 2 diabetes. This program was developed by Stanford University to help manage diabetes symptoms such as tiredness, pain, and emotional issues by helping you learn skills to better manage your diabetes day to day. All 3 of these programs are evidence-based. We have counselors and trainers who go through a training process to be able to and get certified to teach these programs. And there is a national board that certifies them, and they have to go through the program to be able to teach the program. Next slide, please. So some of our health and wellness program highlights. In 2003, we impacted a total of 989 participants for all of our programs, exceeding our goal and increased our impact. By the end of this year, we anticipate to increase our class offerings by 30% through new recruitment and training of new coaches and expansion of our course offerings through our partners. Matter of Balance, 33 classes with a total of 462 participants. Our diabetes self-management program had 12 classes with 112 participants, and chronic disease management, 25 classes with a total of 350 participants. So as you can see, the programs are pretty popular, and we offer them at lots of locations throughout our 4-county region. Next slide. So we also have some faith-based initiatives. We work with a lot of faith-based organizations to make sure that we are reaching seniors everywhere that we can. So Senior Resource Alliance is working with local faith leaders to create a network of care between service providers and faith-based organizations in our community. We leverage those connections to expand our outreach in the community and increase services for seniors. We host an annual resource day where service providers and faith leaders can connect and exchange information and resources to provide to the community. Next slide, please. So our EHE program, I kind of touched on this a few slides back. This is our emergency home energy assistance program for the elderly. It's a 100% federally funded program, and it assists low-income households with at least one person age 60 or older with households when the household are experiencing a home energy emergency. So this is what I was saying. These are folks that may have had their power turned off. We can help them get their electricity back on and help them get back on track. Next slide. So Project Relief. This is respite for elders living in everyday families. This is called Project Relief. It's a program that offers in-home respite that is an expansion of respite currently available through other programs, including evening and weekend respite. to increase the ability of the family unit to continue to care for homebound elderly individuals by providing in-home respite care. So that's another program that we offer. Next slide. So another program that we have in partnership with Orange County Sheriff, Osceola County Sheriff, Sheriff's Office, and soon some other sheriff's departments. So SRA is partnering with Scent Evidence Canine for the organization's Bringing the Lost Home project, which uses advanced scent discriminates canine training to locate missing persons. We've partnered with Orange County Sheriff's Department and Osceola County Sheriff's Department to donate thousands of scent kits, equipment, and dogs, and training, and more. So far, we've had 244 missing people in Florida that have been located through the Bringing the Lost Home program. And you can learn more about this program by going to their website, which is scentevidencecanine.com. It's really a great program. There's some great training that goes behind it. We're right now in the process of getting another 2 dogs for some of the sheriff's offices. Next slide, please. And then elder abuse. So we have a program called ANE, Abuse, Neglect, and Exploitation. It's a prevention program that provides information, outreach, and professional training to individuals, caregivers, and healthcare professionals, while also working together with Adult Protective Services to ensure the health and safety of seniors within Brevard, Orange, Osceola, and Seminole County. Important to note that if you do suspect elder abuse or neglect or exploitation, there's a number an 800 number that anybody can call. It's 800-962-2873. So you can always go to that number. There are some physical signs of elder abuse that we can watch for: dehydration or unusual weight loss, missing daily living aids such as glasses, walkers, canes, those kind of things. Unexpected injuries or bruises, cuts or sores, unsanitary living conditions and poor hygiene, unattended medical needs. There's also some emotional signs and behavioral signs of elder abuse, and those would be increased fear or anxiety, isolation from friends and family, unusual changes in behavior or sleep, and withdrawal from normal activities. You can go to this website, ncea.acl.gov, for more information on elder abuse, neglect, and exploitation. Next slide, please. So we have a few additional programs that we offer. Our heart-to-heart telephone reassurance program. It's a free service that we provide through volunteers that connects older adults with people who are living alone or that are homebound or used to be self-isolating due to COVID-19. I need to change that slide. With caring and compassionate volunteers. These volunteers usually talk to the client once or twice a week. It's everything from a check-in to make sure that they're taking their medications, to make sure that they're sleeping okay, asking them a bunch of questions to make sure that everything is okay with them. And then it could be a discussion about a book that they read or a newspaper article. We've had a few who actually go on like a FaceTime call and who will play checkers or chess with the client. So all kinds of different things. They could read a book together, whatever it may be. It's just something to help a senior feel more connected to a community. And then our Veterans Directed Care Program. This is a program that's offered through the VA. The Veterans Directed Care Program offered enrolled veterans more choice, control, and flexibility over the services they receive. The Veterans Directed Care Program includes participant-directed services as an alternative to the VA's agency-based care options. So this allows veterans who are homebound or who need assistance in their home. It depends what their situation is, but they can actually hire their own caregiver through this program, and there's funding available for them to be able to pay the caregiver, and it's a caregiver of their choice. It could be a family member, or it could be an outside caregiver. Next slide. So these are our lead, this is our lead provider organizations that we work with here locally. So as you can see, we have a good assortment of providers. So we have Aging Matters in Brevard, some community legal services, Informed Families, which is another legal provider, the Alzheimer's Foundation in Brevard County, Meals on Wheels, Seniors First, Osceola Council on Aging, Share the Care, and ADRC, which is the Alzheimer's Dementia and Dementia Resource Center, not to be confused with ADRC, which is which is more for intake and referral. Next slide. And these are a bunch of our community partners. Each one of them has played a big role in some things that we do here locally in the community. And they are also great supporters of our organization and the work that we do to help seniors. And the next slide, I believe that's probably the end. So ways you can get in touch with us. So of course, we are Senior Resource Alliance. Our phone number is 407-514-1800. That will get you to our information and referral line. And through that line, we will have you connected to the right services or to the right individual in our organization to take care of the needs. SeniorResourceAlliance.org is our website. Please check our website out for information that you might not have gotten here or information that I might not be able to provide. But we have tons of information on our website for people to check out and get information on. You can always email us as well at info@sraflorida.org. I'll also provide my email address for you if you're interested. It's Gary.Appelsies, APPELSIES at SRAFlorida.org. So you can feel free to email me if you have further questions that I'm not able to answer today. So that is it for the presentation. It looks like we have some questions.
All right, thank you, Gary. That was really interesting. I'm sure we all heard about some programs that we weren't aware of. And there were a few questions put into the chat. One is, are all of these programs provided by all of the ADRCs throughout the state?
No, there are some programs that we are providing that other ADRCs don't. Some programs are provided variously depending on where location and depending on the programs that the ADRC wants to offer. So they all are different throughout the state. You just have to find out what programs are available in each individual service area.
Okay. I know people can Google, the Aging Disability Resource Center for your area and then find your county through that Google search. And then it'll take you directly to your organization that leads the services there, like the Senior Resource Alliance does for this region.
Correct. So one of the things you'll find, SHINE is absolutely 100% available throughout the state. Of course, any of those the regular programs like CCE, ADI, HCE, EHEAP even, those programs are all available throughout the state. The specialized programs like the health and wellness programs, the Bringing the Lost Home, some of those programs are individualized to each individual PSA.
Right. Okay, so we are, let me just go in order here so I don't miss any questions. How does somebody sign up for some of these programs like the health and wellness program? Do they have to call or email, or can they go to the website, or?
So you can do it any various ways. people can go to our website and fill out a form or email us through our website. We are happy to connect you to the health and wellness programs that way. You can call into our helpline, and they will be happy to direct you to our health and wellness programs office, who will be able to tell people exactly where programs are being offered, at what times, and in what counties. So that's usually the best way to get a hold of us. But an email to that info email address is really helpful. That helps to alleviate some of the calls into the call center that are a little more important at the time. And the emails are directed directly to the health and wellness team, and they'll get back to people.
Okay. What kind of legal services do you provide?
So we don't physically provide any of the legal services. We refer out to organizations like Families First and other legal providers that we have in our network. So we have hundreds and hundreds of providers, not just legal, but other providers in our network. And based on a person's need, their location, and what they're asking for, we can refer to the proper organization. So if it's an estate planning attorney that they need, we have resources for that. It just depends on what the need is.
Are some of those lower costs? Because we run across people a lot of times that might just need a power of attorney or a healthcare surrogate, something like that. And they say, well, I don't really have enough money to pay an attorney. Are some of those provided at reduced cost or for free?
Yep, absolutely. So we do have resources for that. As long as people tell our information referral specialists what their needs are, that they don't have the money for it, or if they need reduced cost services, we will happily find that service for you and provide that service.
Okay, great. Can we get a copy of the presentation? Yes, at the trustagent.org website. The presentation will be posted within a week or so under our webinars. We have most all of our past webinars on our website under our webinar section. And I'm glad that this information is helpful. Somebody wanted to show the last slide. And again, that will be posted. I assume maybe that was a phone number or something. There we go. Senior Resource Alliance. That's the local number here, 407-514-1800. And info at sraflorida.org. And Gary, you said your email address, I can put this into the chat, was Gary.appelsies. I believe I got that right.
Got it, 100%.
Good.
At sraflorida.org.
Right, like you see here, info at sraflorida.org, and Gary's name. Okay, that should be good, Kate. Let's see, the chat still has a few other questions in it. And wow, I had no idea how many programs are available. That's awesome. What a wealth of information. I love the SHINE resource. Yes, SHINE is wonderful. Medicare, although it should be simple, it seems like it should be simple, but it's always the devil's in the details, right? So SHINE can really help to open people's eyes as to what their options really are. So SHINE is a great program. Darlene wants to know, can you help with Medicaid applications for those that do not have financial resources for attorneys?
That is a great question. We do the SMMC LTC applications. So those are the ones that we do. We can help people with that. But in terms of resources for if they don't have resources for attorneys, absolutely.
All right. Deborah wants to post the exact location for the recorded webinars. Kate, could you do that for me? Hopefully.
Yes, I got it.
Okay. Can we report elder abuse in a facility like a SNF or an ALF? Good question.
Good question. I believe you can, because that is information that needs to be put out there. I don't have, I'm not sure about that, but I don't think that you shouldn't report that stuff, but I think it should be reported. So I believe you can report it, and those websites that I gave you earlier in the presentation will be able to help you guide through that.
Right. And I know
I apologize, I'm not the expert on that subject.
I know the ombudsman program also will, if you report abuse in a facility, I know in a nursing home, an ombudsman will be assigned to the case and will go out and investigate. That's the way I understand that ombudsman's program. So the state does take that very seriously. Definitely. Yeah. And you can always Google elder abuse hotline. That, just if you can't remember the number, you don't have it written down, you can just Google elder abuse hotline for Florida, and it's there. A very important number to know. Everyone will receive a copy of the presentation with their certificates. The recording of the webinar, Kate has posted into the chat there, the exact path for the webinars. What does the acronym mean, you said, about help with type of Medicaid apps? The acronym, is that
the SMMC? Is that okay? So it's the
probably
state mandated Medicaid long-term care applications.
Right. So a lot of people think of that as the home and community-based waivers, right? Back, those of us that have been around for a while always used to call it the waiver. There is a waiting list for the waiver. AGIT actually has a information sheet on how to, what that process is, calling, then a phone appointment is scheduled, generally go through a questionnaire, 30 to 40 minutes, and then you get assigned a score and get put on the wait list. So if you get a 5, then you're more like, you're at the top pretty much, and in simplified terms, and can potentially then wait for a call to get off the wait list. Did I?
100%. Yeah, you got it right.
Mm-hmm.
So we try to release, we get the releases once a month, so hopefully within 30 to 60 days, we hope to get those releases taken care of, but we never know, depending on what the state sends back to us.
Right. And just so you all know, I mean, AGIT, all of our clients are on Medicaid. 98% of our clients are on Medicaid. So we live and breathe Medicaid, and I have 2 benefit specialists in our office, and we love to be a resource to you. So don't hesitate to contact our office. And, we can kind of talk you through your questions. We're not attorneys, but we do like to help and to be a resource. So don't hesitate to give us a call. Gary, okay. And I put go ahead, Gary.
I was just going to say, people that are calling in right now, we're scheduling in May for assessments. So we're pretty far booked out. We are trying to catch up. We were short-staffed for a little while, but we are trying to catch up on that. We also have a cancellation list that will put people on if there is imminent risk, and we can move them up into an appointment earlier than that. But just so that you all know that, if a client does call in right now, we are looking at May for assessments, and we're trying to catch up with those as quickly as we can.
Wow. Yeah, that's pretty far out. So a lot of times we tell people, even You know, they're like, well, I'm not sure I need services now. We'll call and start the process. You know, and a lot of times they don't think they really need it now, but they really do. And by the time they get it, they really need it.
Yeah,
So,
so I say that because that also for that reason, because a lot of times people say I don't need it now, but with us booking so far out, I'd really like to get people in as quickly as we can for assessments.
right, right. Linda wants to know, do you offer any help or option to individuals in medical and mental need that are non-residents of Florida or the US with no funds? So we're talking non-residents of Florida or non-residents of US.
The only thing we can offer them is if they are a non-resident, we could offer them a referral to an organization in Florida. But we can't guarantee any services. We don't have services for anybody who's non-residents of Florida. But through
Okay,
our referral line, we could refer them to organizations that may or may not be able to. We never know what the organizations actually 100% will offer. We do
right.
keep our database pretty well up to date. We make phone calls about every 3 to 6 months to all of the organizations in our database to make sure their phone numbers are correct, make sure they're still in business, make sure contact information, addresses, all of that is correct. But well, we can't guarantee, that somebody who's a non-resident of Florida would be able to receive some services.
Yeah. Okay, great. Glenn, thank you for posting the number for the abuse. It's 1-800-96-ABUSE. 1-800-96-ABUSE. Darlene wants to ask, how long are wait lists today?
So that is a great question. Our wait list is, I think we have about, I don't take this for as written in stone, but I think we have almost 2,000 people on our wait list. But you have to remember that a lot of those people are not ranked 4 or 5s. A lot of those people are ranked 1s and 2s. So those people aren't receiving services and usually aren't released as quickly. So those are the people that get those annual reassessments. And hopefully based on the reassessment, they get moved up the wait list.
Now you say annual reassessment. That is not an automatic thing. They have to, if I am correct, they have to call if their condition changes.
So it works. There are 2 things. So if there is a significant change in health, they can call in at any time. So it could be a month later, it could be 3 months later, it could be a year later, and they can go have a reassessment done. We, by contract, are supposed to do annual reassessments every 13 months. Most of our clients do call us back to schedule those. We try to keep on top of those that have not. We also do go through the date of death reports and take people off the list. So we're constantly updating that list and making sure that list is up to date as best as possible. But yes, we prefer the people call in because it makes it easier on our staff to reschedule them. But there are a lot of people that we have to call to make sure that they get those reassessments annually.
Right, right. And I do know somebody's in immediate danger, like you mentioned earlier, and you call the I think it's the abuse line, and DCF goes out, and if they assess that the person is in immediate danger, they do that's a priority for getting services.
Correct.
Yeah. All right. All right. Is there a primary caregiver for someone in a facility? So Sabrina, I'm not sure exactly what you're asking there. There can be I know that there can be a caregiver, in a facility, but the individual is responsible for paying, for that. I'm not sure exactly what your question is there. And we run into that a lot where we actually have somebody in like a nursing home and we're trying to manage a trust for them. so they can, maintain their Medicaid, and they have no one to help them. And that is a big challenge sometimes. Sometimes once in a while guardianship is necessary. It's always a last resort. Hopefully the facility can help as much as possible. Let's see, what else? What other questions do we have? What exactly gets the client to a level 4 or 5?
It's all in the way that they answer the questions. And we cannot, really, by our contract and by statute, we are not able to guide them in the answers to their questions. We have to just hope that they answer the questions honestly. Sometimes we will repeat a question and say, are you sure about this? Let me repeat that question for you. But we have to ask the questions just as it's written in the assessment, and hopefully they will answer in the way that they need to answer. So, oftentimes we'll ask, do you need help with any ADLs, right? And somebody will say, no, I'm fine, I don't need any help. When they actually do need help, but a lot of times people are embarrassed and they don't want to admit to it. So that is one of those things that unfortunately, right, would give them a little bit of a lower rank because they don't need the help right away. So, but there are lots of questions like that just depending on how they answer. And we don't do the scoring ourselves. It's a form that's online that we fill out, and it gives us the rank and the score at the end of the assessment. Automatically, it calculates it for us. So we're not responsible for that. It's really, it's just computerized, and that's how we get the ranks.
All right. So Gary, it's my understanding that once the assessment happens, that the client is supposed to get a letter in the mail that gives them their score and ranking, right?
Correct.
Right. Now, can like a son or a daughter or a friend or somebody actually be there on the telephone or do the assessment for the individual, or how does that work?
So we will always allow a family member or a caregiver to be on the call with them to do the assessment. We will, on occasion, depending on the situation, the caregiver, son, daughter, family member can do the assessment for them, but it depends on the case and it depends what the situation is, and we have to make that determination, at the time of signing them up for the screening.
Gary, does money does money factor into the scoring, how much money they have?
So yes, it does. We always ask for financial information. It is not a requirement to give that financial information on the form. So just, a lot of people think that they're going to have to give their financial information. You do not have to give your financial information, but it could be a deterrent as to whether or not someone gets ranked higher or lower, depending on the other questions that they answer. But the questions about finances do not need to be answered during that assessment if a person does not wish to answer those questions. It could affect their rank, it may not affect their rank. So that's all I can say.
So a lot of times people don't really know the total financial situation of the individual. And so, you can always say, I'm not really sure, we're trying to figure that out. We're working with an attorney, whatever, those answers are, because like Gary said, you're not absolutely required to answer the details of the financial situation. Right.
Right. And we do encourage people to give some kind of financial information because it can only help them in the long run.
Right. If someone has no money, and they're really like needing to go into an assisted living, unfortunately, sometimes they end up in a nursing home in that case. But if they really are much better suited for assisted living, then, definitely let let the screening person know. And very often those people are at risk, they need additional assistance. And, okay, so I think one more question just popped up. It's 11:54 according to my clock here. Is the assessment available in other languages, or can the guardian be an interpreter?
So we do have interpretation services. So we do have English and Spanish folks, language folks on our line, so we can accommodate English or Spanish. Other languages can certainly be. We do have a hotline that we can call for interpretation services, so we can interpretate in other languages, no problem with that. Or if the guardian or caregiver is on the call and wants to interpret, be the interpreter, that's certainly welcome. But
Okay.
we do have a language line that we call into if somebody needs additional language help.
Okay. Gary, just real briefly, I was very interested in the home, the program that's kind of like home and community-based services, but you don't have to qualify for Medicaid to get the services. Can you just expand on that a little bit? So it's for people that are over the Medicaid limit and need some services.
Yeah, so we would recommend them to one of our lead agencies for those services, who will contact them and they may do their own assessment on them, and bring them and see what the services are that they actually need. Some are private pay options, some are grant funded options. So it just depends on what, of course, it always depends on what the service is. But if they're above the limit, there are options out there from some of our lead agencies like Share the Care or Seniors First, who offer respite care, home care, adult daycare services, all of those kind of things. Is that where you were going?
Yeah, I guess the point is you can always call and find out if there's some additional services, if there's a specific need. So,
Yeah.
all righty. Well, I don't see any more questions. This has been very informative. I see Glenn clapping over there, so thank you very much. We really appreciate you spending your time with us today, Gary. And I wanted to let everybody know that next month in April, we are having a speaker on IRAs. And, kind of talking about IRAs, you can ask your questions. His name is Peter Wall. He's the Chief Fiduciary Officer for TrueLink Financial. Very, very smart guy. And he is going to talk about how you can sometimes leave IRA funds into a trust for a person with disabilities, and some of the new laws with the Secure Act, if anybody's heard of the Secure Act. So that is next month in April. I wrote it down somewhere, but it's April 10th. Same second Wednesday of the month. So thank you all very much. Look for an email from Kate with your continuing ed certificate, and go to our website under the webinar section for more information and more webinars. And thank you again, Gary. We really appreciate your time today. Bye-bye.
Thank you for having me, and have a great day, everybody.
Thank you.